don't want to wait too long, so I will welcome you all officially. Um, Thanks for being on time. Tonight, we'll be focusing on Module 12, Quality Improvement. And I think you all should have received an email earlier today from Dr. Turner with some discussion questions. I'm also going to drop a link into the chat. The questions were added to Zoom. So the bulk of this evening, Dr. Turner is going to explain that in a second, but the bulk of the evening you'll be in small groups discussing your quality improvement proposals. So if you use the link, I'll paste it again before we actually go into the rooms. The link I just put in the chat will bring you to Canvas, and I posted the questions there. So you can open that page, and there's also a link to download the questions in a PDF if you can't find them in your email. So no excuses for not finding them. And I think that's all I have in the way of announcements. So Jane, I'll let you go on ahead.
Okay, well, thanks. Hi, everybody. I want to start by saying I had a chance to review the quality improvement proposals that you posted on Canvas, and they're excellent, really good. I put just little comments on each one of them, but I learned so much from reading them, and they're really good proposals. And I can tell that some of them are hypothetical, something that you might do if you had the opportunity, and some of them are part of your life project or part of the project, what you're already doing in your day job, either in clinical settings or in other settings. So some of them, thanks, Jeannie. I see that you're on and off the, okay, no cameras, okay. That some of them were things that you're actually going to be able to implement. And you will have noticed that in many of my comments, if you looked at each other's comments, it's kind of like, for a QI, try to really focus in if you can and take baby steps so that you can get something in place and then move on to the next. Often we are overly ambitious when we go on. And this model of improvement that is presented in the module and with the niche Q course that you all went through, this model of improvement works in many settings. It's not the only way to improve services. One of the reasons this model of improvement was developed, and one of the reasons it is successful, it is that it is based on the idea that you can't just close the factory down and retool everything and start again. It's for activities when you're continuing to be active. It's one of those fixing the airplane while it's in the air kind of things, which is often true in industry. The model was not developed in medicine initially, it was developed in industry, and it's usually true in healthcare. You can't just say, we're not going to see patients for 6 months while we think about our workflow and make changes and make improvements. You got to keep working. And so that's part of why making small changes as you move ahead. Most of this evening we're going to spend in small group, and you'll have a chance, and I'll get back to that, to talk with each other about your models. I want to take a few minutes at the beginning and talk about some real world application of this model of improvement, so you can see how it can go from kind of the macro picture, federal funding, coming down to a state, coming down to clinics, to step-by-step minor tiny changes, then that get scaled up and spread back up to a broader level. Because you want to make your improvements in your practice, whether it's an educational practice or a clinical practice, or say with Alasia in HR, if you're working for a company and trying to improve their recruitment and retention of individuals with disabilities, or wherever it is, you make the little changes on the ground, but you want to be able to spread them and scale them so that they are helpful to a broader population. So the project I wanted to talk to you a little bit about is one that I'm involved in and have been involved with, and I think it's 12 years now, And that's a HRSA funded project. HRSA is the Health Resources Service Administration, the federal agency that funds MyLend in the workforce development area. Well, I'm working as a medical consultant on a grant to improve outcomes for children and youth with epilepsy. And to improve outcomes, and step back to say, well, let's improve services. So this is HRSA money that comes to, I think there's 7 or 8 grantees across the country. And Michigan Department of Health and Human Services is one of the grantees. The PI, the main person on this grant is Lonnie Barnett, who is the director of Children's Special Healthcare Services. And you all know Lisa Huckleberry, who works for the Family Center, which is also part of Children's Special Healthcare Services. So there's some bridges there. And this is, again, HRSA money, and it's in the area of improving services for children and youth with epilepsy. So there are these different organizations around the country that are funded, and the major goals of the grant, the major areas that HRSA wants us to improve services are in 1, telehealth, 2, transition from youth to adulthood, 3, communication and collaboration between primary care and subspecialists and other professionals, and 4, shared decision making. So, and this grant cycle is 4 years and we're in our 4th year. So how do you do that? You've got these different places all around the country. And in Michigan, we are working with 13 different clinics, some of which are primary care clinics like the MSU Pediatrics. I'm part of that group, primary care. Also MSU Neurology is participating, so neurology clinic. Children's Hospital of Michigan, adult neurology and child neurology are both participating. Helen DeVos Children's Hospital, so big varieties. So when you think about it, how do you do a quality improvement project that works across those very different? Also, we have an FQHC, Alcona FQHC. Are you familiar with FQHC, a federally qualified health center? So it's primary care for all ages. So we have broad goals, and then we tone it down, bring it down to more specific projects. And everybody gets to, we present a menu of possible projects, and each practice gets to choose one. So let me just give you an example of project and then show how that then can be expanded upwards. MSU Pediatrics has chosen to do a project that combines transition. This is one of their projects out of about 6 that they've been doing. But the one currently is to combine transition from youth to adult providers and shared decision making. And the way they've done that is they've worked on, developed a 1-page fact sheet. Well, it's actually more question sheet. Here are things to think about, which we would call a patient decision aid, to give to people to help them think about when they move from a pediatric practice to an adult practice, what kind of provider should they look for? Do they want to go to an internist? So what is an internist? Do they want to go to family medicine? What is a family doctor? Do they want to go to a nurse practitioner? They should think about, does this new practice take their insurance? Does this new practice, as they choose a practice, do they have someone on call to answer questions after hours, if that's important to them? Where is it? Can they get there? Is it on, if there are any transportation issues? So this PDA, patient decision aid, is really designed to stimulate a discussion with the pediatrician when they come into a visit, so that they think of the right questions to ask and they can make a wise choice as they make that transition to adulthood. So how does that fit into quality improvement? Well, you can use the PDSA cycle by developing the tool and then deciding what's your workflow. Who's going to give it to the patient? Who's going to give it to the family? Do they get it at check-in? Do they get it at checkout? Is it sent to them through a portal? That's not going to work at MSU because teenagers aren't allowed to use the portal because of confidentiality issues. So right there, it's like, whoop, out that one. But what's the workflow? And then create a way to document it, not labor intensive, an easy way to document it in the medical record if they got it, so you can measure whether people are remembering to give it. And then after a month, go back and pull 5 charts of kids with epilepsy, because that's the target audience, and see whether they got the PDA. Just as the first step. A later step would be to come back and look and see, was it useful to them? But the first step is just, let's take one baby step forward. Let's see if they got it. Okay, so that's for one practice that has about 70 kids with epilepsy and cares for about 8,000 kids total. The practice decided to use this tool not just for kids with epilepsy, but for all of their teenagers as they're approaching transition age. So they can pull more charts and take a look. But that's just one practice. So how do you spread it? Well, through the network that is funded on this grant, shared the tool. We have a meeting. We share the tool, we talk about it, and others say, woo, I'd like that tool. Can I have that? And then they take it home and they remove the MSU logo and they put their logo on it and they doctor it for their community. Because one of the things this tool has is also the names of some of the adult providers in the area that take kids. They adjust it, and there's no copyright issue because it's grant funded. HRSA funded it, so it's open to everybody. And then other practices can start to do the same. And then we have a meeting with the other grantees in other states and similarly share what has worked for us, and then they can pick it up. So you start from the federal, bringing the funding down with some goals and some incentives and some funding, not a lot of funding, and then you take it down to the practice level and really to the individuals in the practice. They try it out, they use it, and they tweak it and then share it back up with a broader group. Make sense? I wanted to go over this just to kind of give you an idea of how these quality improvement projects can work in the real world and are being implemented. Any comments on that or questions? Have any of you ever been offered a PDA, a patient decision aid, in your clinic? They may not call it that, but something that kind of, and we expect people to come in if we're proponents of having a good discussion and shared decision making. The patient and the family is at a disadvantage because they're coming in without the knowledge, and if they have the knowledge, and then they have to think of what about shared decision making, just putting in a plug for shared decision making. Okay, so it is now 5:45, 5:46, a good time to go into breakout sessions. And I think we're going to do 3 groups. So there are 4 or 5 of you in each group, and give you a chance to talk to each other about your projects. We can do this for an hour. And I'm allowing a lot of time. I've allotted a lot of time for the breakout sessions because I reviewed the evaluations about what trainees found useful previous times we've done this module, and it was breakout session, discussion, breakout session. So you will have a chance to talk about not a formal presentation, but here's my proposal. And the question should help to guide that a little bit, but you don't have to follow it like 1, 2, 3, 4. One of the things, part of what you're going to have an opportunity to do is learn about each other's discipline, because as you describe your proposal and describe the why behind the proposal, this improvement needs to be done because everybody's going to learn much more about your field, about ABA, about using natural environments in teaching, about issues of access to your clinics, follow-up. Several of you have proposals about needing follow-up. Several of you have proposals about the importance of referrals from physicians to your specialty. So anyway, you'll learn from that. And then also get some practice on how do you do the PDSA cycle and how do you focus in. That's a big part of having effective quality improvement, is being very clear of what you're trying to improve and how you're going to do it and how you're going to measure it and have those things match. So often measures are chosen because they're easy to measure and are not necessarily really relevant to the issue or really meaningful. And that's one of the big challenges. And you can challenge each other on this. You're expected to give good feedback to your colleagues. Questions before you go into small group? Pretty quiet tonight. Okay. I'd like it if faculty want to go into a group. Mike, I would love to listen to a group. I'll turn my video off when I'm in the group, so I'm not intruding, but just have an opportunity to listen. And other faculty, you may want to join a group, or you may decide to use this time to, make dinner or whatever. But okay, well, we're going to go into 3 groups, so that gives you a chance to hear from several of your colleagues, and you have ample time for lots of discussion about your proposals and your fields. And let's come back together again at 6:45, just for a little bit of a wrap up. And if you get bored in your group before that, come back to the main group, and Mike can let us know, and we can break. We can break earlier if you've exhausted your discussion.
Sounds good. I'm gonna put the link one more time to the discussion questions that they're in Canvas. Jane sent you these questions earlier today in an email, but just for ease, if you have that open on your computer, then you'll have the discussion questions, kind of lead your discussion. So, okay, I'm going to go ahead and open the rooms up, and we'll see everybody at about 6:45.
Thanks, Mike.
Yep.
Okay. Well, I am not going to ask for official feedback or notes from your sessions, but I'd really love to hear if anyone has any comments, anything they'd like to share with the group of what they heard in their session or what they've learned from doing this. Aaron.
Hello, sorry, I lost track of where the little hand raised thing was.
That's all right.
Anyhow, I really appreciated hearing people's thought processes and what's important to people, depending on their field of interest. So in my group, we talked about transportation challenges, trying to bridge that gap between city kiddos and people who are out way far away from the cities, how to get them into the city for their appointments. We talked about dyslexia and literacy gaps. We talked about verifying hearing aids to make sure that they are working well for that person and they're built correctly from the manufacturer especially, and then talked about fall risk screening in audiology clinics. So it was just really nice to see how passionate people are with their projects. And we got into some really great discussion where we already started to do I think the study part of it, where we were saying, hey, that could be a backlash from this group. So what if you did this instead? Or I wonder about this. So just really facilitated some great communication, great conversation.
Anyone else? You can raise your hand or you can just unmute. Leo's unmuted.
I was gonna say that I am very happy with the way things turned out in my group. I got to experience a pair of very passionate individuals, and it's very refreshing to see that people are so passionate about what they want to do. So I thought it was a great discussion and a great breakout room.
I was in that group. I was listening to that group, and I agree. It was a great discussion, a great breakout group. It was interesting to hear how several of the proposals fit into the life project the trainee is doing, so that they kind of all fit together. And I got a real sense of, as I mentioned in the group, of why people are in my lend, kind of what they would really like to make better, for individuals with neurodevelopmental disabilities, what they want to tackle, what they're interested in. And it was really not, I loved that. Others, anybody from the other group want to have anything to say? You don't have to.
I would just say that I thought it was interesting. A lot of the proposals ended up kind of intertwining, not obviously directly, but I thought it was interesting that so many different proposals were about communication between different specialties and how interdependent everyone is and how much more people want to be connected to other providers and be aware of what other providers do with their profession, which I think is what's great about MyLend. But like how to educate patients and other providers on what everyone does and how to make that whole system more efficient was kind of a general theme among a lot of our group.
Mm-hmm. Before we end, another thing I mentioned in the group that others might want to know is there is a journal specifically dedicated to quality improvement in the British Medical Journal. Now, this is more for quality improvement projects that are in clinical settings. It's an online electronic journal only. But if you're heading into an academic career, it can be very nice to have an article, a publication on your CV, and it's really helpful to other people to be able to go to the journal and see what you learned and not make the same mistakes you made. They can start out, a step ahead from what you've done in your QI. And I don't have it handy now, but I can send it around a link to that journal if you're interested. You're probably not ready to take advantage of it now. I will say that in our practice at MSU General Pediatrics, where we're all general pediatricians, but we have very little time for research. It's mostly seeing patients and teaching. We've been able to have several publications. One of the group has really taken the initiative. And part of that is that we do quality improvement projects. So the work is done, but then when you sit down, when are you going to find the time to actually write an article? This particular publication makes that relatively easy because it gives you a field. It says, okay, what's your introduction? Why did you choose this project? Why is it important? In, 500 words or less. Okay, what did you do? What did you learn? How do you, what are the implications? And it makes it much easier. For me, it's much easier to kind of fill in a form versus start with a blank page and write an article. So I will send that, probably not until I come. I'm not in Michigan right now, and I'm not very serious about working right now, but I'll get it to you before too long. I can send it to Mike to make. If by sending it to Mike, then it's on Canvas, because if I send it to you just in an email, you're going to lose it. If you're like, the rest of us, I mean, it will be there, but you might want to take advantage of that sometime. Any other comments? Any comments too about any of the other faculty that listened in?
Hi, this is Lisa, and yeah, I'm like always impressed too, and everyone, just all the conversations and their ideas. I think every year they just blow me away even more, but it was really, really good, and really, just a bunch of amazing trainees we have.
Yeah, okay. Well, thank you, everybody. And again, you'll see, and I have minimal comments, but some comments on Canvas. I really appreciate the work you did on this. I think it was very, very high quality work, and I learned a lot from all of you, and I think you learned a lot from each other. And we will end 7 minutes before the hour, if that's okay.
Unless anybody wants to extend it and go longer tonight. I mean, it's up to you. Joking, of course. Thanks, Jane. Thank you, everyone.
Thanks, everybody.
put a link to the eval in the chat, but of course you'll get it emailed to you as well. So please, please, please just take the 2 minutes and give us feedback. We will see you again for Module 13 Zoom session on the 21st of this month. That's with Danny Drevin. He'll be leading you through that. You can look ahead to that module. There's an IEP experience there, and I know we're going to have some opportunities for everybody to participate virtually in an IEP process coming up. So if you're able to take advantage. Otherwise, I will see you all in a couple weeks.